So hello folks, today we will be differentiating between upper GI bleed and lower GI bleed. First, the anatomical source. Upper GI bleed is proximal to the ligament of triads, that is from the esophagus, stomach or the duodenum, while lower GI bleed occurs distal to the ligament of triads, that is from the jejunum, ileum, colon, rectum or the anus. Then the common causes are peptic ulcer disease, gastritis, esophageal varices, malarious tears, erosive esophagitis, while in case of lower GI bleed, it can be diverticulosis, colorectal cancer, hemorrhoids or inflammatory bowel disease. Now the type of bleeding or the appearance of bleeding. So in upper GI bleed, it's hematemesis, that is bloody vomiting. It can be bright red, it can be coffee ground, or there is melena, that is blood in stools, that is black tarry stools. While in lower GI bleed we see hematochezia, where there is again blood in stools, but it is bright red or maroon blood, that is per rectum. Now the color of blood in upper GI bleed, it's bright red, that means fresh, and coffee ground indicates that it has been altered by gastric acid. While in lower GI bleed, it's bright red or dark maroon and it is not altered by the gastric secretions. Now the associated symptoms in upper GI bleed are epigastric pain, vomiting, there is history of NSAIDs use or alcohol use, and in lower GI bleed we see lower abdominal pain, change in the bowel habits, weight loss and diarrhea. Now the blood urea nitrogen in upper GI bleed, it's often increased, often elevated. Why? Because of digestion and absorption of blood proteins, and in lower GI bleed it is usually normal.